Now in this section, we will discuss some other congenital infections that can affect the pregnancy in the perinatal period. And the infections we will talk about in this section will be parvovirus, listeria, and malaria. Parvovirus B19, usually this is the picture, it has lace-like rash on extremities is present, and it's caused by parvovirus B19. Induce hemolysis and severe anemia in fetus. So it causes hemolysis, destruction of the red blood cells, and as a result of the destruction of the red blood cells, anemia occur in the fetus, and then anemia has so many consequences on its own also. So main effect that can occur as a result of parvovirus infection is hemolysis and anemia as a result of that hemolysis. It can cause high drops and heart failure. Management of parvovirus, we do serological testing. If it's IgG positive and IgM negative, it means the immunity is present. If it's IgG positive, negative, but IgM positive, then it means the infection is recent. Weekly ultrasound with the MCA, PSV, Doppler is performed, and high drops or moderate severe anemia, then we use intrauterine transfusion is performed to treat that anemia which is present. So again, if the serology shows that there is IgG positive or negative, but IgM is positive, then it means the infection is recent, and it should be then weekly Dopplers and ultrasounds performed, and then intrauterine transfusions are required sometimes. Then in the third scenario, if IgG is negative, IgM is also negative. It means there is susceptibility, and avoid exposure and repeat serologies in 4 weeks. IgG positive, IgM positive, then it means it's recent infection. If both are negative, it means person is susceptible. No infection, avoid exposure. So in case IgM is positive, it indicates recent infection. If both IgG, IgM are negative, it means there is no infection, but the patient has susceptibility to get infected. So exposure should be prevented. Next is listeria. Listeria is the infection caused by Listeria monocytogenes. Its intragastric infection causes rapid early pregnancy loss. So intragastric means inside the stomach. Infection causes rapid loss of pregnancy. These are some changes that can occur in Listeria. There is spiral artery pathology, decidual infection, placental pathology. So all these structures are affected in Listeria. Widespread fetal infection and histopathology. So widespread fetal infection and histopathology, ontogeny of implantation damage, decidual immune response, maternal previous infection, response to Listeria vaccine. So all these are the different effects that can occur with Listeria infection. There is pathology of decidual side, there is pathology of placental site or placental tissue, and all these abnormalities can affect the fetus badly and even cause early rapid pregnancy loss. Then dangers of Listeria, there is miscarriage, premature labor, low birth weight, and infant death. All these are the complications of listeria infection. These foodborne illnesses can infect your baby even if you do not feel sick. So even if the mother is not sick, completely normal, asymptomatic, it can affect the fetus. The management of listeria is presumptive exposure to listeria. Is patient symptomatic? If patient is symptomatic, then check if patient has fever or not. If patient has fever, then simultaneous testing with blood culture and treatment with IV ampicillin and obtain placental culture if delivered. And then if there is no fever, then we should do expectant management and consider obtaining blood culture. And then if patient is not symptomatic, no testing or treatment is done. Next is the malaria. Malaria is the condition which is caused by the malarial parasite Plasmodium falciparum. It is most virulent of the malarial parasites. So it can cause maternal anemia because of, again, it attacks the blood cells and cause destruction of the blood cells. So anemia in the mother is common, and they can cause stillbirth, abortion, and low birth weight delivery. So all these can occur as a result of infection by Plasmodium falciparum or by the malarial parasite. Parasites grow in placenta, and placental malaria occurs in anywhere between 15 and 16% or 60% of cases. Effects on pregnancy and fetus in case of malaria in areas of low or epidemic transmission, acquired clinical immunity low or none, clinical illness, there is severe disease, risk to mother, risk to fetus. Risk to mother is death from severe malaria. Risk to fetus is spontaneous abortion, delivery, and stillbirth. And in areas of low or moderate transmission, usually there is acquired clinical immunity, low or none, asymptomatic infection. So if there is low or moderate stable transmission area, usually the infection is asymptomatic. There is maternal anemia and maternal morbidity and placental infection, which can again cause infant mortality, impaired child development. So depending on the area, if it's in area of low or epidemic transmission, usually patients have clinical illness and it can cause severe disease, but in condition where there is stable transmission, usually the condition is less severe and it can be usually asymptomatic. Risk of acute malaria to women is severe anemia and its consequences. Anemia can cause like condition like pallor, shortness of breath, and it can affect the fetus also. So it has serious consequences. In fetus, and there is growth restriction, miscarriage, preterm birth, congenital infection, and perinatal death. So all these complications can occur with malaria, and again the seriousness of the condition depends on if it's low or epidemic transmission area or if it's a stable mild to moderate transmission area. The management is depend on nature of infection. Prophylaxis given in the form of chloroquine phosphate at a dose of 300 milligram each week, starting 1 week before travel and continuing for 4 weeks after leaving the area. And these are all the side effects that can occur: stillbirth, low birth weight pregnancies, and abortion. Chloroquine-resistant strains are treated by combination of chloroquine and pyrimethamine with sulfadoxine or proguanil or mefloquine. So patients who are resistant to chloroquine, they are treated with combination therapy, which include chloroquine and pyrimethamine, again with sulfadoxine or proguanil and mefloquine. Folic acid supplements should also be used in patients with malaria. That was all about this section, in which we talk about some other infections that can affect the pregnancy, including listeria, and then we talk about the malaria. Thank you for watching sqadia.com.